one of the things that you see, that I see, is the epic inefficiency in our current healthcare delivery and infrastructure. That's how you can save tens of billions of dollars.
Absolutely.
Just by wringing some of the inefficiency out.
And that administration cost, that's a function of there being so many different insurers and so many different healthcare plans. You know, if you look at Medicare Advantage, there's 2,500 different plans. You know, that means hospitals have to have administrators and coding elements for every single one of those plans. And that's crazy. And that's why I call this thing the 10 plan. Under the 10 plan, you know, there's just one program and you pay Medicare pricing to the hospitals. And I'll tell you the biggest scam, Andrew, the ultimate scam right now in healthcare. I've turned into a healthcare geek. So they have this group called MedPAC who does all the analysis for how Medicare rates are set. They're being told that hospitals say they lose money on Medicare rates. The reality is it's a great lie. Hospitals are not losing money at Medicare rates. They just throw everything plus the kitchen sink into their cost
into that bucket. Into the cost bucket.
Money, right? Look at Toronto, Canada, which has effectively, not complete single player, but effectively single player. And look at New York City. A hospital in Toronto and a hospital in New York. If we line them up, all the costs are going to be the same. The costs for doctors are the same. The cost for real estate, nurses, supplies, overhead, everything. So the question I asked was, why does Toronto pay X dollars for a procedure to the province of Ontario, that hospital, and it's far less than what
New York's like 2.5x or whatever it is.
Yeah, and they claim poverty. There's a disconnect there somewhere, and the disconnect is because they throw in all these incremental costs to make it look like their costs are higher, which pushes up the pricing to all the insurance programs, which makes all of our healthcare cost more. And so if we get down to the cost basis of what hospitals truly pay, and now's the time to do it with all this reset, then we can push down the pricing of healthcare costs significantly.